Hi, this is Pam Dunwell from Your Nurse Advocate Consulting, and we are back to the Senior Care Summit 2024, and we are excited to introduce our next speaker and our next topic. This video you're going to be able to find in Area of Need 3, which is health and wellness, and we're going to be talking about dementia care. So Sheri Fairman is the owner of Dementia Care Solutions, and she's going to be sharing her presentation today on the changing relationship when dementia is in the picture. So Sheri, welcome. We're really excited to have you.
Thank you so much. All right, guys. So as mentioned, I'm Sheri Fairman, and I'm owner of Dementia Care Solutions. And you might be wondering, what is this agency, Dementia Care Solutions? Well, we are a consulting agency. And essentially what we do with consulting is we work with people with dementia, so people experiencing brain change, and we work with their care partners. So we provide consulting, which includes education about what's happening in the brain, what should be happening in the brain, and what's happening when things aren't working out so well. And how do we shift our care and approach to better support people? And everybody's situation is unique and different. And so we help you where you're at, whether you're a person with brain change or a family care partner. We also work a lot with professionals. So we spend a lot of time in facilities with home care agencies, hospital, hospice, anybody who's paid for providing care and help with the same. We do workshops, a variety of workshops that are not just knowledge-based, but content and skill-based. So we actually help people practice the skills we teach. And along with that goes coaching. So you're not alone with us. We're going to help you really hone those skills. And community presentations and general support. And what about me? I'm Sheri. So I am actually a person with a master's degree in social work. So that I have completed in 2014 and have spent my time since then really working with people with disabilities, people who are elderly, and people who are providing care for those. I have multiple certifications. As you see here, the DICE approach is an approach to dementia care. But most of my certifications are with TIPA SNOW's positive approach to care. I'm an independent consultant, trainer, coach, champion teacher, and I also have a certification in an approach to screening in dementia for people with intellectual and developmental disabilities. I love TIPA SNOW's approach, the positive approach to care, so much I decided to work with her. So I also work on the team with her. And I've got a lot of years of experience, not just professional, but I also cared for my mom who had multiple ailments, but vascular dementia was one of them. So today we're going to talk about the relationship that changes as this disease progresses. So I want you to think for a minute about your relationship with the person living with dementia, whether it's a professional relationship or a family member, a spouse, a child. So think about that. How has this dementia impacted the relationship? What has changed? Are we having any kind of role reversals? This was my mom, but now I kind of feel like I'm playing the mom role. I'm experiencing some changes in how I interact with my husband now that he's got some brain changes. I'm taking on responsibilities that the other person would always do. And then what about companionship? Am I feeling like I've got somebody who can fill the role of being my support, my other person? So think about how that dementia impacts this. Why do you think that happens? Why do you think these changes happen? Think about other relationships you might have that have also experienced change, not related to dementia. So you might have raised a child who, as they've grown older, have become more independent, and things you did for them, they do for themselves. And maybe they go off to college, and now your relationship is very different. And boy, is that relationship different when they come home from college for a little break, and all of a sudden you've got your adult child in your house, and it's well, what role do I have? Do we have a curfew? Do they need to follow certain rules? Yeah. So there is a lot of things that happen and changes in relationships, whether dementia is involved or not. But think about what you've done in other relationships that have changed, that made it successful. So what were some of the things that you've done that helped you cope? Because you tried to hold on tight to the way things were, but it probably didn't work. And so you've realized you have to do something different. This relationship is changing. I'm going to have to change, because we know we can't control other people. We can only control ourselves. So think about those adjustments you made to make that relationship work. And how can you apply that to your current relationship with the person you're living with who's having some brain change? Now, got that all in your head. Now I want you to think back a little bit. What was the first thing that happened that made you go, something is not right? This is kind of a weird thing that's happening that isn't like that person. When did you notice the first signs that something wasn't right? Sometimes people think about, you know what? It was weird that they paid the electric bill, and then a week later they paid the electric bill again. Or they didn't pay any bills and they've always paid their bills.
Sheri, I just wanted to say that brought up a perfect point with my mother-in-law. She's going to be 90 in April. She sent her daughter a birthday card. Her daughter never got it. She always got it. And it finally came back in the mail, and she didn't put the address on it. She put her name and the city and state and zip code, but didn't put the address on it. And so, things like that just made me think of that.
Interesting. So you noticed that your mother-in-law, yeah, she missed a step there, filling out the envelope. She got pieces of it, but not all of it. Yeah. So does she have a dementia diagnosis, or just an interesting thing that happened?
She doesn't, but I believe it's at this point, like I said, she's going to be 90 in April, and I believe that's undiagnosed. I mean, she's gotten extremely forgetful and repeating things, and
Okay, so you're noticing more symptoms,
yes,
because
yes.
missing the steps in a task is certainly a symptom, but it doesn't mean, if that's the only thing that's happening, it could be normal aging. Our brains change as we age. But if you're noticing a multitude of other things that are also going on, it would be a good idea. But thanks for that example. That's a great example of things that we're like, sometimes we don't notice it in the moment, but then in hindsight, right? In hindsight, we might notice something. For example, my husband does all the cooking, okay? He does all the cooking. But what happens if I'm at the stove making dinner and suddenly realizing, well, when did this start happening? What the heck? You know what? Come to think of it, it was probably about 6 months ago when he was telling me that his feet hurt and didn't want to stand by the stove. So he was actually maybe sitting down and doing some stuff, but not. And then it added up. Okay, now it ended up, now I'm cooking all the meals. But in hindsight, I can be like, you know what? That is funny. But in 4th of July, I've never used the grill. And that's right. He said that he didn't feel like it. So people with dementia are clever, right? Just like the rest of us are clever. There's no difference. Dementia doesn't take away your intelligence, but it still allows me to be able to cover for myself. And I can come up with things like, no, you know what? You guys do that. I'm not really interested in church anymore. I don't really like gardening. And I come up with reasons why I don't want to do things. But really the thing is, I don't know the steps to do it anymore, right? Or I can't start it. Yeah.
And that
And
I'm sorry, that reminded me just of another example. We had a client, we got involved early with Alzheimer's, and she called me, and she was very active at church. And the first thing she said to me was, she says, Pam, she says, you might wonder why I haven't been going to church anymore. And she would host Bible study at her home. I mean, she was very involved. And she says, I realize I'm becoming more forgetful, and I don't want to go to church anymore because I'm afraid I'm not going to remember the names of the people I've known for years. And that was, it just pulled at my heartstrings, but that was early on.
early on. So on one hand, she's recognizing some things going on with herself. And on the other hand, she can recognize what other people are responding to her, and she's come up with a solution. So that's a skill. I'm not going to go. I don't like it. So I'm not going to bring myself to it. But what that really speaks to is the importance that people know how to respond to people experiencing brain change. They're experiencing changes, shouldn't we? We should try, yeah, to make that person feel comfortable and welcome. But that's a great example of, well, in hindsight, they were talking about not wanting to go a year before we even started to really start to get really concerned. Like they were still driving, right? And people can drive for a long time, maybe. It just depends on what their cognition is, what that impairment is actually affecting. All right. So thinking about other things like when you talk to your doctor, did the doctor jump on and say, ooh, this sounds concerning? Or did the doctor say something like, well, you're 80, what do you think? What do you expect? Well, you shouldn't expect to develop a dementia. A dementia is a pathology that is not a part of normal aging. So when we first notice the signs and symptoms, why do you think it takes us so long to actually act on it? Because some people find themselves in a silver alert situation where in Wisconsin, silver alert is when somebody who is elderly is now missing. And oftentimes they've driven their car off. And it's like, whoa, we still haven't even talked to the doctor yet. And somebody has gotten to the point where they're struggling to make decisions and make safe decisions for themselves. So think about that. Why don't we do things sooner? Why don't we talk about it? Could it be stigma? Could it be, I want to be respectful? I don't want you to feel like I think less of you, so I'm not going to say anything. What if that person gets mad? What if they deny it? We don't know what to do and how to respond to it. So we wait. Sometimes we're able to talk about it real quick, but we wait because we need to get past the whole, oh, that was weird idea with the symptom. That was a weird thing. We usually want to make sure it gets to, whoa, that was so not like them. They're heating up the Tupperware on the gas stove. They're not putting it in the pot. Like that cannot happen. We need to do something. But in reality, they were having symptoms a long time ago. Actually, we know that by the time we actually start showing symptoms, we've been having some brain changes happening for about 10 years. Our brain is just so amazing. It does rewires and workarounds and everything so that we don't see any symptoms. But what's happening in the brain is like, ooh, this isn't working right. I'm going to go this way and I'm going to do it this way. So by the time we see a symptom, we've been having changes for a while yet. So once we decide that it's time to start to approach this, whether with the person who's experiencing brain change, we hope, or somebody else, my adult daughter, my neighbor, my friend, my sister, my spouse, whoever, somebody that I can talk to about what I'm noticing. So finding this support is imperative. How do you think having support will impact this whole situation? For a lot of people, it makes a world of difference. For most people, finding the right support. So let's talk for a little bit about how dementia actually impacts the relationship. So dementia can actually impact how people can communicate. Just getting words from their brain out their mouth, finding the words they want to use, understanding what you're saying to them, and then actually be able to physically produce the words, using their mouth and their tongue to speak. So sometimes people will experience aphasia. And aphasia is this, expressive aphasia is this inability to communicate. Often they have a flat affect with their face and a difficult time getting sound out. They might be repeating themselves. That gets frustrating. I know I'm preaching to the choir, but having somebody repeat themselves or ask the same question you've already answered can actually cause some friction in this relationship, right? Their pace can change, which means it might take them a little longer to say what they're, so yeah, that's right. So now if we don't understand that their pace can change, we get frustrated. What do you want? We start doing what? Guessing. Are you thinking about dinner? Did you want dinner yet? Or no. Oh, you wanted your coffee? And the person with brain change is getting frustrated because I'm trying to use what I've got and you're not giving me the time I need to do it. Also thinking about how they're interpreting us. So as this disease progresses, people can get even better at reading your facial expressions, your tone of voice, your body language. These are really important pieces that our brain we're born with, the ability to read these. And so this is the part of the brain that's also last to die. So other things that change, memory problems. So when I'm noticing my loved one is not able to come up with the word or has forgotten something, do I prompt them or do I just let it go? I don't want to upset them. Do I repeat the thing that they keep forgetting? I want to make sure I'm being respectful. If they've remembered something incorrectly, do I fix it or do I let it go? This is a conversation we want to have as early as we can, because some people would actually really like you to say, you know what, don't correct me. You know, that's embarrassing. Or some people would say, oh my gosh, I would never want to be telling a story. Because people with dementia can tell great stories. Oftentimes we recommend, don't correct them. Let it be. It affects that respectful care. So we don't want to change how we respect them. We want to respect them and continue respecting them. This is why we prepare them for things. You know, my mom would want to know that she's got a doctor's appointment on Friday. So I'm going to let her know today. But oops, we let her know. And now we've got 2 days of, I have a doctor's appointment. When's my appointment? What? I don't want to go. I don't think I need it. And it's like, wait a minute. Is it still respectful if I don't tell her until we get closer to the time we need to leave? Or is that disrespectful? So how we respect people has to change. We have to, they're different now, right? So as they're different, we have to change too. And how we respect them changes. Sometimes we'll see some unpredictable behavior from them. You know, somebody, depending on the disease, depending on where they are, depending on their communication, they may very well come out of the bathroom with their pants down. And as a spouse, and we have a party happening with friends over, how do we respond to that? My husband would never do that. And here he is in all his glory. Ah, how do I respond to that? What am I supposed to do? What is my role? This relationship doesn't look like it used to. Sometimes it can, but a lot of times it's not going to. And I need to grieve that loss. Managing normal daily tasks, things like toileting, personal cares, brushing teeth. Yeah, I never had to tell my mom to brush her teeth. She wore dentures. She would never let me see her with her dentures out. And now she's handing them to me with Fixodent all over them and doesn't know. This is a strange situation I find myself in because that's not like my mom at all. Telling someone to take their medications. I don't even know what my husband takes necessarily. If I had to help him with that, that would be such a strange role to step into. Making meals, getting dressed, helping people take off their clothes and put on new ones. Because if they often take off their clothes, they might put them back on. Right? So I need to cue and interject in situations where I've just never had to before. Now think about it from their perspective. How that might feel to have somebody cueing them and interjecting when maybe they don't necessarily see they need that. The sexual relationship. Yeah, we might not actually have that desire with somebody who we've loved. And now because of these changes, I'm not feeling that same way. Is that okay? Is that okay? Or am I being cruel? What if that person is still interested? Or what if they're not interested at all? Is it okay to engage in a sexual act with them if they've got dementia? Yeah, if you're consenting adults, guess what? It is, even if they have dementia. This is a moment-by-moment assessment. And then lastly, future planning. If we're starting to experience some early dementia symptoms, we might want to start talking about that trip we're going to take to Europe in 5 years. Let's maybe do it now. We used to snowbird. We'd go to Florida. Maybe that might not be able to happen. Or if it's going to happen, how are we going to make it happen? Let's start planning. Are we going to stay in our home or are we going to downsize? Are we the type that would consider a facility? Let's start having these conversations. Dementia impacts a lot. And so what we really want to do is grow with people. They're not dead. They're living, they're thriving. If we do this right, if we look at this like something that's a wah, this is it. Well, now we're just going to wait till dementia takes your life, because it can. If you don't die of something else, dementia is a progressive disease. But as Teepa Snow, we're all in this terminal condition called life. And if we look at it as something we're just going to wait to die, and we're going to put our whole life on hold and take care of this person, we're going to be in a real situation where none of us are thriving. So as we develop this new relationship that we have with the person, the trust relationship can change. Who you were as a care partner was predictable, right? You know each other, whether it's a spousal relationship, mother-child, sibling, friend, right? But all of a sudden, I might respond differently. If my husband has brain change and I'm getting frustrated with him, I might get, will you stop? But I've never done that before. So that can actually impact his view of me and our trust. We have to embrace change. I know change is hard for all of us, but it is inevitable. So as this disease progresses, we're going to continue noticing changes. We have to change with them. We have to learn how to shift our approach and our care. And we have to support them to be independent. Support them to be independent. Don't do everything for them. What can they still do? Have them do it. And understanding the different types of dementia. There's similarities with them, but there's a lot of differences. So if you know what type of dementia that person has, learn about it, because they affect different parts of the brain, which can cause different symptoms. Because sometimes we don't know what's happening. And that person, we might think we need to call the police. And we might actually think they need medications, when what they really need is a shift in our care, shift in the environment, maybe medical care, maybe they have an infection. So keeping those things in mind. And then it impacts the relationship. And this one, I'm singing to the choir with that, but care partners can feel frustrated, angry, resentful. And then guess what comes after that? Guilty. I know they've got dementia. I don't know why I just get so angry. Grief. It's grief. The more frustrated you get is in direct relationship with how much help you need. Let's think about this from that person with dementia's perspective. They're saying, I need someone who can support me, who understands my disease, and that I am who I am, but I'm different now. And that my care partner can say, I am who I am, but I need to be different now. I borrowed that from Tipa. I love that. I need someone who can see things from my perspective. So I have an approach to dementia care I call the fish approach, where people with dementia are like fish in the water. Get in the water with me. This is where you meet me. This is where we start this relationship. Help me express through words and actions what I mean and how I feel. Help me express. Don't take it from me, but help me. Help me work with you while you're supporting me. Don't do to me. Don't do for me. Do with me. Help me manage my new roles and responsibilities. I have different abilities now. Help me with what I'm still able to do. And help me fill my day with meaningful activities. I don't want to sit and watch Gunsmoke. I might say I do, but I don't. And I just don't know how to start it. But if you ask me if I want to do something, I'm probably going to say no. So I'm asking you to know how to communicate to me. Ask me for some help. Just I could use your help. Come with me. Worry about what we're going to do later. Just get me up. And give me space and time away from you as well. I'm going to say that one again, because I'm a person with dementia, talking to my care partner. I need time away from you. And you need to get that started early in the disease. Because as this disease progresses, the more attached I am to you, the more attached I'm going to be. And the harder it's going to be to share the care, to get me involved with other people. This is good for me to have multiple people I can rely on. So if I'm starting to grab onto you, let go. Okay, so that's the person with dementia's perspective. Let's take a look at the care partner perspective. I need someone who supports me. I need a team. I got to get people together. My support person needs to see my perspective and listen to my concerns without judgment. Listen to my concerns. Help me cope with the grief and loss that I'm experiencing. Help me develop and practice more effective responses to the changing behaviors and abilities, because there's changing. Because if you help me cope, it'll reduce my distress. It'll change the dynamics between us. It takes a village. Guide me in finding other supports and resources as my role and my relationship changes. I'm going to need help with legal stuff, financial stuff. healthcare, social. I need to get out. I need to do some of the things I enjoy. I maybe need to go to church or other spiritual. I need to meditate. I need somebody to help me with my home repairs because my husband can't do it anymore. Provide me with a time and place to focus on my own needs and wellness. Possibly help me sustain other relationships that might have been fractured or broken. Encourage me to go out. Don't just say, how can I help you? Say, I can come over on Fridays at noon, from noon to 4. I'll be there so that I can just be gone. Yeah. So think about who your supporters can be. Anyone, but make sure that they're genuine, helpful to you and your care receiver. So the person living with brain change, don't just go out and ask them. Wait, if you're going to ask them, be specific. I need help with this. Is this something you can do? If not, that's okay. What can you do? And make sure that your care partners know a little bit about dementia. So I'm going to have you guys take a piece of paper out. Okay, and a pen. Got your paper and your pen. And start by drawing a circle in the middle of your paper, like that. And write inside it your name and the person you take care of, their name, because you're a team in the center. And then I'm going to have you draw another circle outside that. And in there are going to be your first people you ask for help. The very first people that you're going to talk to. And this is different for everybody. I worked with somebody, very first person they talked to was their next door neighbor. They didn't even talk to their kids yet. So the next person that you're going to reach out to help. So you can put names in there because, you've got people, Now draw a circle around that. And I'll write the next people you might reach out to. Your neighbors, church. All right, guess what we're doing? Another circle around that. Now we're reaching out to, this is when we start looking at support groups, clubs, organizations. Now we start talking to out-of-town family. Hey, can you come home? We're going to actually be bringing in past friends. Like, hey, you used to go running with my husband. Do you think you can come over and visit him? Because we're sitting in the house because our world is getting very small. And then you see even around there, we've got day programming. There's other services, home care agencies, home delivered meals, transportation, lifeline buttons, maybe even a facility. This is putting your team together. So what do you notice about what you put on your paper? Does it look like this drawing? Why does it feel harder to gather your team early on versus later? Could it be because early on we're trying to protect the person? We don't want to open our world up to a lot of people. So we're just going to do the cares on our own. We're not going to tell anybody. And then as the disease gets bigger and bigger, it's harder and harder to hide it. Now I've got to ask for help. And now it feels like crisis mode. So how does your support bubble look compared to this one? Think about one thing you can do to add to your team. Because it takes a village. It takes a village with dementia care. That's all of us. The neighbor, people who live across the street from a facility are part of the team. They don't know it maybe, but they are. We all got to be in on this together. There's lots of things we can put together, but we've got to gather our gear for our team early. So there's a little analogy called about the frog in the water. And I don't know if you've heard this, but there's a tale that says you can put a frog in a pot of water on the stove, cold water. Frog's going to love it, swimming around. It's lovely, right? Turn the gas on. Get that water heating up. That frog will not notice the temperature changing until it's too hot. And when it's too hot, that frog can't jump out anymore. It's gotten too hot. Don't be a frog. Think about how that compares to care partnering. Because sometimes we do. We stay in it, and we stay in it, and we stay in it till we can't jump out. We're desperate for help. Gather your gear early. I want to thank you guys for giving me this time to talk with you about being care partners and just that relationship and how it changes as the disease progresses.
You know, Sheri, this is wonderful because I think, it meets a lot of people where they're at, but maybe that they're afraid to acknowledge where they're at. And you've just made it okay for them to recognize where they are, in this process. And so I think it really will help a lot of people begin to move forward. So if we know that with the different forms of dementia, and everybody that has one or the other is may experience different symptoms. So if they're in a spot where they really are looking for some guidance, and they want to use a service like yours, how do they go about what does that process look like?
So I do offer a 30-minute free consultation. So you could call me 920-883-5076. You can email me. You can go on my website under contact me and fill out a very simple form. So there's like no wrong way to find me. And it's it's a 30-minute free consult. Happy to help. Now, there is, and I'm not sure, is this all over or?
Yes, it is going to be national. We do have speakers from, I believe nine or 10 different states. Mhm.
Oh, okay. Oh, wonderful. So this actually, I can provide consults on phone, virtually, and in person. So if you're not around us in Wisconsin, it'll probably be a virtual or a phone. But there are a lot of other options for you as well. TIPA Snow's Positive Approach to Care offers consults as well. They do a 30-minute free consult, and then if you would like to continue working them, there's options with that as well. And in Wisconsin, we have dementia care specialists in every county that offer consultation services. So, yeah.
Well, that's great information. And because I know, and the reason I wanted to have you share that is we get a lot of questions often from people that we're servicing, with adult children of aging parents. And so dementia is a very common theme that comes up. And so I really thought it was very important to have a presentation like yours, and also, give them the resource. And I just want to let everybody know, and I'm not sure which order you're seeing this video, but we do have, for every registrant, we will supply a nice PDF, a nice guide that's going to have the agenda, the listing of all our videos, and then we'll have information on all of our speakers, their contact information, website. So you'll have all that information handy for you. But Sheri, I just want to thank you so much. I really appreciate it. It was an amazing presentation. Is there any final thoughts that you'd like to say before we close?
Thank you so much for having me. And as far as you out there at Care Partners, gather your team. You need to gather it as early as possible because this is a marathon.
Well, thank you so much, Sheri. We look forward to seeing you again soon.
Thank you.